Year in on this pandemic, as states consider easing restrictions, there are some startling findings that may back them up. Medical reporter Liz Bonus shares what we're learning about some of the outcomes of the pandemic.
Hey there, everybody. Well, studies throughout the past year have demonstrated public health measures such as wearing masks or avoiding close contact with others can help slow the spread of the coronavirus. When you compare those with strict lockdowns that mandated many of these things to those that did not, in some cases there are identical outcomes. Take, for example, states such as Florida and South Dakota. Instead of long-term shutdowns on bars and businesses, they said,
instead, we should focus on protecting the elderly who are likely to die from this and allow younger people to continue on with their lives, preventing the economy from collapsing and the terrible ramifications that would have.
Others, such as Connecticut, New Jersey, and California, shut down everything from restaurants to theme parks. Many still shut down, following the cautions of Dr. Anthony Fauci.
If we continue to vaccinate people, get more and more protection, without all of a sudden pulling back on public health measures. We will do that. We will gradually be able to pull them back.
But many are now looking at this data from the Centers for Disease Control and asking which public health measures. If you see these states laid out on this bar graph, when it comes to COVID-19 death rates per 100,000, Florida and California largely the same. So are Connecticut and South Dakota. Many infection protection specialists say what largely explains differences isn't shutdowns, it's nursing homes.
Well, the people in the nursing homes are the most high risk for having bad outcomes from COVID. That's where most of the deaths have occurred throughout the pandemic.
State dashboards back that up. California had more than 8,800 deaths linked to long-term care facilities. Florida, 4,800. A rate those caring for older adults say they've seen almost completely stop as vaccines have begun.
Over the last 3 weeks, we've had none. So I definitely, again, attribute that to the vaccines and, secondary to families coming back. I would say that's one of the things we're most grateful for, is that people aren't losing their lives in nursing homes to this virus if they choose to get vaccinated.
Vaccines, of course, the one thing right now already helping to stop that spread. I'm medical reporter Liz Bonus. We'll throw it back to you.